Module 5, regarding the roles of the Perinatal Palliative Care Coordinator, will briefly touch on 4 roles and focus on the role of communicator. The Perinatal Palliative Care Coordinator plays multiple roles within the perinatal palliative care team, as well as with the mother, father, and family. The care coordinator is a clinical expert in her own right, most commonly as a nurse, social worker, or physician. Each of these healthcare professionals bring their knowledge and skills into being a care coordinator. Strong background in maternal-child health is needed. Experience in end-of-life or palliative care is very helpful. The care coordinator also serves as an advocate for the family and the baby within the healthcare system, the interdisciplinary team, with specialists, and sometime within the family itself. Excellent communication skills are needed to fulfill the role of communicator, specifically with interpersonal communication and within the interdisciplinary team. Teaching patients is a common role for many healthcare professionals, especially nurses. As an educator, the care coordinator provides information and resources that helps the family understand their baby and the services they will interact with while having and caring for the baby, in the hospital and possibly at home. The roles of facilitator and interpreter are used to reduce barriers within the healthcare system and between individuals. Medical jargon is a common barrier that often requires interpretation for families so that they understand what is being said. The role of communicator is likely the most important role for the care coordinator, and it requires unique skills within palliative care and end-of-life care. To begin, a self-assessment of one's communication skills is recommended, such as the one found through the provided link. We often take communication for granted, but in the circumstance of caring for the mother, father, and other family and support persons who are in crisis due to an unexpected fetus's life-limiting condition, what is said and how it is said is critically important in every family encounter. Carefully consider your existing communication skills. What are your areas of strength? What are your areas of weaknesses? There are some basic guidelines for communication with patients. Being non-judgmental will allow for open communication and avoid you conveying limits on what you will listen to. Listening is the most important skill to have. Truly pause, focus, and listen. When you do speak, do so authentically. Be honest and straightforward so that the family knows they can trust what you say. Use clear language while also conveying empathy. That is, connecting at an emotional level. Use clear language while also conveying empathy. That is, connecting at an emotional level with expressing caring. Reflective listening is a way to accomplish all these things. Communication skills are learned through studying new techniques or approaches, and then through practice, receiving feedback, and through thoughtful self-reflection of what went well and what didn't in all encounters. Communicating with a single person or with a couple requires careful listening and then reflecting back what you heard. They will then affirm that you heard them, which will prompt them to continue, or they will correct your understanding, which also prompts them to continue and clarify what they mean. Clear and empathic communication is essential for the care coordinator. Communication can convey caring and can also empower parents because they know they have been heard. Parents who know that they have a right to ask questions and control the flow of information will feel more confident in their role of making care decisions on behalf of their child. Reflective listening is a communication strategy that involves 2 steps: seeking to understand a speaker's idea, then offering the idea back to the speaker to confirm that the idea was understood correctly. First, listen to what is being said. Determine the underlying meaning of the message. Then reflect that back in your own words to the person to seek confirmation that you understood what they were saying. For example, a mother might say, "How could this happen to my baby?" You recognize that she is trying to make sense of this new information, so you could reply, "It sounds like you are overwhelmed trying to make sense of this news." If you have conveyed this accurately, she might reply, "Oh my, yes, I don't even know what to do next." If you got it wrong, she'll correct you. "Yes, I am overwhelmed, but I don't understand how my baby got so sick, and I didn't even know it." People often speak broadly and non-specifically. You really want to understand what this mother is trying to tell you. Reflective listening requires you to listen carefully, get to the meaning underlying her words. It lets her know that you are listening, you care, and you want to understand. It is very powerful. Practice this with someone today, someone at work or at home. Another related technique is the nurse approach to conveying empathy and lets the person know that you are listening. Through focusing on the individual's emotion, you let them know that you care and you hear their pain, concern, or whatever they are feeling. In many medical situations, the goal is to seek mutual understanding, just as reflective listening does. When conveying bad news, it is helpful to add what is called a warning shot, letting the parents know that this is going to be a serious conversation. There is some serious news we should discuss. Then they are alerted to the topic at hand. From there, using the ask, tell, ask approach, you determine what do they understand, tell them what is going on. Your baby has a serious condition and the baby's in trouble. And then you ask them again, what is their understanding? Spikes is a commonly used mnemonic that outlines the steps of giving bad news. In order to do this effectively, clear, honest communication is needed, and reflective listening is extremely helpful. Ultimately, the goal is to create a space where the parents can express their understanding, listen to further information and explanation. You respond with empathy, and then you verify what their understanding is at the end of the conversation. In palliative care, it is customary to meet with the patient or family with several members of the interdisciplinary care team to discuss the baby's condition and to determine how the parent's goals can be met by the team. This slide outlines the basic steps for such a meeting. As Perinatal Palliative Care Coordinator, you are a member of the team, but with a particular emphasis on being the bridge between the team and the mother, father, and other support persons. All of the care coordinator roles come into play during such a meeting. Receiving a great deal of information from several different specialists can be overwhelming for families. It is prudent to plan a debriefing with the family after the goals of care meeting has ended.